So, Dr. Oliverson, do you anticipate that this bill will have an adverse impact on adolescent care in the state?
Actually, I think it refocuses it on mental health care, which is what we should have been focused on, and where other countries now are moving that are kind of have sort of seen all the research, weighed it all, and said, you know what, this isn't working. Let's focus on mental health. Let's set these treatments aside until such a time as a person reaches the age of majority and we know that they're in a position to make an adult decision. That's essentially what we're doing here. So no, I don't think it will impact adolescent health negatively.
And I wasn't just talking about transgender adolescents. I'm actually talking about all adolescents.
Okay.
And are you aware that since this bill has come before us, several adolescent care doctors have left Dell Children's Hospital?
I am not aware of that, Representative. I know I think there's an investigation of some kind there, but I don't know the details of it.
So over the weekend, we got a communication from a constituent who has a child has a doctor at Dell Children's, and I'm just going to read part of it. Our pediatrician is no longer with Ascension as of May 5th, but the doctor's photo is still on their website as taking new patients. We were called and told our son was no longer with Ascension and would not be connected to other pediatricians in their network. Now, this is not a transgender child. This is just a child with a concussion that needs a doctor's help. The other issue is that our child, prior medical records were gone from the system. Anyway, she goes on, but...
Wow, I think that's a HIPAA violation, actually, to abscond with a patient's medical records.
And I'm sure that there will be further investigation into this.
I hope so.
It's very concerning. I'm extremely concerned about the health care of all adolescents in Texas, with the concern that doctors are facing that, they don't want to get in trouble, and we keep telling them what they can and can't do, and sometimes there are gray areas. I just wanted to express that and hope that perhaps we can do something to address that.
I understand your concerns. Trust me, as a licensed physician in the state of Texas, it's very important to be familiar with what the Medical Practice Act says. And so I hear where you're coming from. I appreciate it.
Thank you.
Mm-hmm.